Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. Folks, this is episode 247 of the Everything Medicare Podcast. We've been off the last couple of weeks, and I really do appreciate your patience and understanding. I came down with something. Having a 2-year-old like I do, and any of you that know, any of you that have been parents of little kids, any of you that are currently grandparents of little kids, you understand. Your kids go out into the world, they go to daycare, they go, do this activity, do that activity. They go get babysat, they go play date, whatever the case might be. They are not hygienic, right? They pick their nose, they do gross things, they're just gross. And they come home covered in germs. And they roll all over me and infect me. So I believe what I had was a cold. My wife and I got it pretty bad, but it was a pretty bad cold, to be honest with you. I mean, got tested for COVID, it turned out to be negative. But it made it difficult the last week or so. I could barely talk. My throat was completely I sounded horrible. I sounded like Scott Farrell, if any of you old radio listeners know who that is, old radio DJ that sounds like this sometimes. And just didn't want to do a show like that. I just want to make sure that every show we do is good. I want to make sure that every show we do is good. So here we are. Let me start with this, folks. I feel that a topic that is very, very important to address is why does I'm willing to bet that 99 out of 100 people experience this, but why do people on Medicare get year-round calls from people saying things like, oh, there's changes in your area, right? Or they're saying, there's an enrollment period going on right now. Or they say, you have 3 days to take this off or otherwise it's gone, or some other type of bullshit like that. Why? Why do we see this, right? It's not open enrollment. The Medicare open enrollment period is October 15th through December 7th. There's another enrollment period that is less talked about called the open enrollment period that goes from January 1st through March 31st. But right now, in June, we're not in any freaking enrollment period, right? So why are you getting these calls? Why are so many people getting these calls? Millions of people around the country. I'll do my best to kind of articulate it and kind of explain. So if you thought what I just said, maybe in your head when you're getting one of these calls, it's not open enrollment, things aren't changing, you're right. Congratulations. Medicare plans, particularly Medicare Advantage plans or Part D prescription drug plans, do not go through any changes in the middle of the year. They just don't. The plans are required by the Centers for Medicare and Medicaid Services to come out with their benefits, and they're supposed to be current from January 1st through December 31st. And then they announce their changes for the next year, typically publicly on October 1st. And then October 15th through December 7th, if you don't like your particular plan changes, you are able to make a change respectively. So why do these people call up and say that there are changes? Well, it's because that they know a majority of people on Medicare don't know any better, and they don't really know how the whole thing works. 99 out of 100 people on Medicare probably don't know what I just said. They do know about the enrollment period. They do know that that's the open season, but they might think, well, maybe there's a window that I didn't know about, or maybe the government opened up another window or something along those lines. There are things that are known as special enrollment periods, which essentially what that means is if you went through a life-changing event recently, like let's say you moved out of your state, that would be a life-changing event. Let's say you live in Phoenix, Arizona, and you relocate to San Diego, California. Well, if you have a Medicare Advantage plan, your Phoenix, Arizona Medicare Advantage plan that's specifically designed for your area, that has networks of hospitals and doctors for Phoenix, Arizona, is not going to be available for people that live in San Diego, California. You're going to be forced to change your plan. If you don't, eventually it will cancel. You'll be forced to change your plan to a California plan. So that's a life-changing event. That's looked at as a special enrollment period. Let's say you get assistance from your state government. Let's say you have Medicaid for people on low income, or let's say you even have something known as extra help or low income subsidy that helps with the cost of prescriptions. You're granted a time period where the first 3 quarters of every year you can make a change if you want to. There's a million of these little things, but typically something has had to have happened for you to be able to qualify for something like this. In areas like Florida, for example, that typically has yearly hurricanes, you're typically going to find that a lot of times, most years, especially around the time period that the natural disaster is even going on, there might be what's known as a FEMA special enrollment period that allows you to change just to kind of combat the natural disaster. Not that it has anything to do with the natural disaster, but something that they do. So there's things like that. But there's actually a large portion of people that do not qualify for a special enrollment period. Let's say you're leaving your group health plan. That's a special enrollment period. There's a lot of them. But some people just live in the same place. They didn't have a disaster go on. They don't get any subsidies from their state government. Say they're not in poverty. They don't qualify for anything. They haven't recently retired, and they'll still get these calls. Well, these organizations are typically one of 2 possibilities that are calling you, and a lot of times they're robocalls or something like that. So there might not even be a person you're talking to. But they're typically one out of 2 possibilities, folks. One of 2 possibilities, most likely. And really what the one out of 2 possibilities is essentially they're either a call center, right? There's someone that's in a boiler room somewhere and you're just a number on a page to them, or they're a scam. They're trying to get your Medicare number and they're trying to act like they're Medicare or something like that. That actually is happening more than we've seen in recent memory. And sometimes if they're a call center, they will say you qualify for a change when you don't. They will lie on your application, say that you've recently experienced one of the things that I mentioned earlier, and sometimes the insurance companies don't check, sometimes Medicare doesn't check, sometimes it slips through the crack, and they get you to change. Unethical, illegal, not compliant, but they do it anyway. And how do they get away with it, you might ask? Lack of regulation. The government really hasn't taken it very seriously, unfortunately. Even big organizations, people that run commercials with retired football stars pull this kind of crap year round. A lot of these organizations get fined every year by Medicare, but they're not shut down. Why? Well, without getting too deep into the weeds, I can only say that they don't care. They don't care. There's just something there that they just don't take it as a serious priority to increase this kind of regulation. Now, I'm of the opinion that I don't necessarily think increased regulation is always a good thing, but in this type of situation where it's clearly people are getting taken advantage of, people are getting scammed, that's something that we'd like to see some action on, right? But unfortunately, it doesn't happen. This is the main thing that you need to know. This is the main thing you need to understand. If you are on a Medicare Advantage plan or a Part D prescription drug plan, you can't change it legally and compliantly until the enrollment periods that I mentioned. January 1st through March 31st, that's for Medicare Advantage only. And in the fall, October 15th through December 7th. And that's where essentially it's free for all. You can change anything. If you're on a Medigap or Medicare supplement like a Plan G, F, or N, you can change your plan all year round if you want to. The only criteria is you have to be able to pass health questions to be able to qualify for the new plan in most situations. I would just say be very aware, have your guard up, and don't get taken advantage of. If you do get a call from somebody, get their name, their company name, and report them. If they are exhibiting the type of characteristics that I am mentioning. Because I've seen people a lot of times, especially when you're dealing with these people in the boiler rooms, they're essentially taking calls or making calls to all 50 states all over the country. They don't know your little backwater town from a hole in the wall, excuse me. They don't know the hospital systems. They don't know the plans very well. They're just picking a big name insurance company and they're like, oh, XYZ insurance company. They're good some places. That must be good. We'll just throw that person into it. I've told this story on this platform before. I had a client of mine get taken off of her very good plan with us, and it was the best plan for her by a mile, placed into a plan that did not have prescription coverage. She's a diabetic, takes 3 insulins every month. She ended up in a situation where she was stuck in that plan for months. We couldn't do anything about it because we don't lie on applications. And she was forced to pay $1,000 to $1,200 a month retail costs for these prescriptions. Be ever so careful, folks, especially this time of the year. We're starting to see more and more and more of this. Have your guard up. Do research on people. And make sure that you understand what you're doing before you do it. Don't call the TV commercials. I guarantee you, if you call the TV commercials, exactly what I'm explaining here will likely happen to you. I've done several YouTube videos on our YouTube channel where I've actually reviewed the TV commercials, pointed out their misconceptions, their lies, their outright lies a lot of times. There's even some videos where I've actually picked up the phone and called the company myself, and they've just been horrifically rude. They hang up on you. They tell misinformation. It's really actually quite shocking. I encourage you to go check out some of those videos if you haven't already. And this is something that you just need to be prepared for, folks. You need to be aware of. Anyway, folks, just short little episode, something I wanted to talk to you about today on episode 247. We're going to be back to weekly shows every single Monday. And we really appreciate you folks taking the time to listen. If you really would like some honest and real help with your Medicare, my company works with people in 38 states. The list of those states can be found down in the description if you're watching this on YouTube, or in the show notes if you're listening to the podcast version. Our office number is 801-255-5340, 801-255-5340. My name is Christian Brindle. I'm a published author. I have been doing this show for you for 3 years, giving you information on Medicare that you won't find anywhere. Honest, unbiased, and nobody's put out more free Medicare information than we have in the country. I think it's pretty safe and fair to say that. Anyway, folks, thanks so much for taking the time. Hope you have a great rest of your week, and we'll see you next time. Have a great day and a great week. We'll see you next Monday.